Hello everyone, welcome back to our community and public health lecture. So for today we will discuss the communicable diseases. These are the learning outcomes for today's lesson. At the end of this lecture, you'll be able to describe the burden of diseases caused by communicable diseases, describe the criteria that are used to establish that an organism is a contributory cause of disease, identify factors that affect the transmissibility of the disease, identify the roles that barrier protections play in preventing communicable diseases, identify the roles of vaccination in preventing communicable diseases, identify the roles of case screening, finding, and contact treatment for the prevention of communicable diseases, and describe a range of options for controlling the HIV/AIDS epidemic. So this will be the order of our lecture for today. First, we're gonna start with the introduction, then to the burden of diseases, establishing an organism as a contributory cause, measuring potential impact, barriers against diseases, immunization, case screening, finding, and treatment, human microbiome, control of HIV/AIDS, control of influenza, and control of rabies. Diseases due to infection form a large part of the history of public health and are again essential part of its present and its future. Infections of public health importance are primarily those that are communicable. That is, they can be transmitted from person to person or from animals or the physical environment to humans. Communicable disease may be caused by a wide variety of organisms ranging from bacteria to viruses to a spectrum of parasites including malaria and hookworm. What is the burden of disease caused by communicable diseases? For many centuries, communicable diseases were the leading cause of death and disability among all ages, but especially among the young and the old. Communicable diseases are not only the causes of widespread epidemics of disease, but they can also become endemic or be regularly present and become routine causes of death. Communicable and non-communicable infectious diseases play a key role in maternal deaths associated with childbirth, infant, and early childhood deaths, as well as deaths of malnourished infants and children. The last half of the 20th century saw a brief respite from deaths and disabilities caused by communicable diseases and other infections. This was due in large part to medical efforts to treat infections with drugs and public health efforts to prevent infections, often with vaccines, and to eradicate and control other infections. Even as these great accomplishments were underway, warning signs of bacteria resistant to antibiotics began to appear. Staphylococcus organisms resistant to current antibiotics began to plague hospitals in the 1950s until new antibiotics were developed. Resistance of gonorrhea and pneumococcus to a range of antibiotics became widespread. The World Health Organization and US government-sponsored programs, such as those to promote the eradication of malaria and TB, were not able to sustain the impacts, and the goals were trimmed back to control rather than eradicate. In addition to the large number of epidemic communicable diseases, a few diseases have the potential to produce a pandemic. So what is a pandemic? A pandemic is an epidemic occurring worldwide or over a very wide area, crossing international borders and affecting a large number of people. As we will discuss, pandemics of influenza have occurred multiple times in the past and are likely to occur in the future as ongoing mutations to produce new strains capable of person-to-person transmission. How do we establish that an organism is a contributory cause of a communicable disease? Establishing that an organism is a contributory cause of a disease traditionally relied on Koch's postulates. Koch's postulates hold that in order to definitively establish a cause and effect relationship. All of the following four conditions must be met. 1. The organism must be shown to be present in every case of the disease by isolation of the organism. 2. The organism must not be found in cases of other disease. 3. Once isolated, the organism must be capable of replicating the disease in an experimental animal. And 4. The organism must be recoverable from the animal. Ironically, TB or tuberculosis could not be shown to fulfill Koch's postulates. However, a very useful set of modern Koch's postulates has been developed by the National Institute of Allergy and Infectious Diseases. Modern Koch's postulates require 1. Evidence of an epidemiological association between the presence of the organism and the presence of a disease in human beings. 2. Isolation of the organism from most of those with the disease. And 3. Transmissions to definitively establish that an organism is a contributory cause of the disease. These criteria may be referred to as association, isolation, and transmission. At times, researchers have been able to directly isolate and transmit disease from person to person. For instance, fluid from chickenpox skin was collected and transferred to other individuals, resulting in active cases of chickenpox. How do we measure the potential impact of a communicable disease? First, we have the R0. So the R0 has gained wide visibility through movies and the media as an indication of the potential of the disease to cause an epidemic. R0 is increasingly being used as a measure of the potential for transmission of a communicable disease. R0 is intended to measure the average number of infections produced by an infected individual exposed to an otherwise entirely susceptible population. R0 has been used to estimate the degree of communicability of a disease and the potential of the disease to lead to an epidemic. When R0 is greater than 1, it implies that each infected individual will on average infect more than one previously uninfected individual. Therefore, an R0 of greater than 1 implies that the number of infections will increase over time and produce an epidemic. What are the following factors that have a major impact on R0? First, we have the transmission probability. This is a probability of infection being transmitted during contact. The route of transmission greatly affects transmission probability, with airborne infections, especially those transmitted by sneezing, having the highest rate of transmission. And the period of communicability. So this is the period during which the infection can be transmitted, including frequency and duration. The more contact made while the disease can be transmitted, the greater the R0. The longer the period of communicability, the greater the R0, especially if the disease is transmissible in the absence of symptoms. Next is the route of transmission. A wide range of possible routes of transmission have been demonstrated for communicable disease. Communicable diseases may be transmitted from person to person, or from animal species, or from physical environment to humans. So this table here outlines the major methods of transmission of human disease and examples of each of the method. So we have insects. So this causes your malaria, Lyme disease, West Nile virus, dengue fever, Zika, and yellow fever. For other animals, we have rabies, avian flu, anthrax, and plague. For airborne, influenza, severe acute respiratory syndrome, measles, chickenpox, tuberculosis, and a common cold. For sexually transmitted infections or open sores, we have gonorrhea, syphilis, herpes genitalis, chlamydia trachomatis, hepatitis B, and HIV. For water or food, we have hepatitis A and cholera. For fecal oral, we have polio and salmonella. For transfusions, blood, or contaminated needles, we have HIV and hepatitis B, C, and D. For transplacental, we have rubella and HIV, breastfeeding, HIV, and contaminated articles or fomites, we have chickenpox, common cold, and influenza. And lastly is the period of communicability. Diseases with the potential to create human epidemics are often diseases that can be transmitted from person to person, while the individual is free from symptoms. Classic examples include influenza, chickenpox, measles, and mumps. Transmission often occurs in the days or weeks prior to the development of symptoms, but it can also occur from individuals who never develop signs or symptoms of the disease. In addition to those who transmit the disease as part of their initial exposure to it, other individuals may transmit the disease after they have recovered from the clinical disease or after they are infected with it but do not develop symptoms. Those individuals without symptoms but with the ability to chronically transmit the disease are called as chronic carriers. Examples of diseases that often lead to chronic carriers are HIV and hepatitis B and C. What public health tools are available to address the burden of communicable diseases? A range of public health tools are available to address the burden of communicable diseases. Some of these are useful in addressing non-communicable diseases as well, but they have special applications when directed toward infections. These include barrier protections, including isolation, quarantine, immunizations designed to protect individuals, as well as populations, screening and case finding, treatment and contact treatment, and efforts to maximize the effectiveness of treatments by preventing resistance. Let us look at each of these tools. How can barriers against disease be used to address the burden of communicable diseases? Examples of barriers to the spread of infections are as old as hand washing and as new as insecticide-impregnated bed nets, which have had a major impact on the rate of malaria transmission. Barrier protection, such as condoms, is believed by many to be the most successful intervention to prevent sexually transmitted diseases. The use of masks may be effective in reducing the spread of disease in healthcare institutions, such as hospitals. A special form of barrier protection consists of separating individuals with disease or potential disease from the healthy population to prevent exposure. Isolation occurs when individuals with symptoms of a disease are separated from those who do not have symptoms. Quarantine occurs when those suspected of having a disease but without current symptoms are separated from others. Isolation in sanitariums had a major impact in reducing outbreaks of tuberculosis in the 1800s and the first half of the 20th century. The 2014 to 2016 outbreak of Ebola brought attention to the continuing limited use of quarantine to observe the exposure of a disease during its incubation period or the expected time between the contact and the development of symptoms. How can immunizations be used to address the burden of communicable disease? Immunization refers to the strengthening of the immune system to prevent or control disease. Injections of antibodies may be administered to achieve passive immunity, which may provide effective short-term protection. Inactivated vaccine or dead, and live vaccines or attenuated live can often stimulate the body's own antibody production. Live vaccines utilize living but weakened organisms that also stimulate cell-mediated immunity and produce long-term protection that more closely resembles the body's own response to infection. Vaccines are now available for a wide range of bacterial and viral diseases and are being developed and increasingly used to prevent infections as varied as malaria and hookworm. Unfortunately, it has been difficult to produce effective vaccines for some diseases such as HIV/AIDS. Vaccines, like medications, are rarely 100% effective and may produce side effects, including allergic reactions that can be life-threatening. Live vaccines have the potential to cause injury to a fetus and can themselves produce disease, particularly in those with reduced immunity. Some vaccines are not effective for the young and the elderly. Therefore, the use of vaccines require extensive investigations to define their effectiveness and safety, as well as to identify the high-risk groups for whom they should be recommended. Some infections, especially those viruses that are highly contagious, can be controlled by vaccinating a substantial portion of the population, often in the range of 70 to 90%. In this situation, those who are susceptible rarely, if ever, encounter an individual with a disease. This is known as herd immunity or population immunity. When a population has been vaccinated at these types of levels for diseases, such as chickenpox, measles, and polio, those who have not been vaccinated are often protected. For some vaccines, such as live polio vaccine, herd immunity is facilitated by the fact that the virus in the vaccine can itself be spread from person to person, providing protection for the unvaccinated. Thus, public health authorities are interested in the levels of protection the community, that is, the level of protection of the unvaccinated as well as the vaccinated. How can screening and case finding be used to address the burden of communicable disease? Ideally, screening for communicable diseases fulfills the same criteria for non-communicable diseases. Screening for communicable diseases has played a role in controlling the spread of a number of infections. For example, screening for TB and syphilis has been an effective part of the control of these infections even before they could be cured with antibiotics. Today, screening for sexually transmitted diseases, including gonorrhea and chlamydia, are a part of clinical care. HIV screening has long been recommended for high-risk individuals and for populations with an estimated prevalence of above 1%. Screening for communicable diseases has often been linked with a public health practice known as case finding. Case finding implies confidential interviewing of those diagnosed with a disease and asking for their recent close physical or sexual contacts. Case finding techniques have been key to the control of syphilis and to a large extent of tuberculosis, both before and after the availability of effective treatment. The advent of effective treatment meant that case finding was of benefit both to those diagnosed with a disease and those located through case finding. Successful case finding aims to maintain confidentiality. However, when following up with sexual contacts, confidentiality is difficult to maintain. The potential for public recognition and attendant social stigma has inhibited the use of case finding in HIV/AIDS in many parts of the world. The reluctance to utilize case finding may change in coming years as early diagnosis and perhaps early treatment become more effective in controlling the epidemic. How can treatment of those diagnosed and their contacts help to address the burden of communicable disease? Treatment of symptomatic disease may in and of itself reduce the risk of transmission. Successful treatment of HIV has been shown to reduce the viral load and thereby reduce the ease of transmission. Similarly, treatment of active TB or tuberculosis reduces its infectivity or ease of transmission. In addition to direct treatment, a public health tool known as epidemiological treatment or treatment of contacts with a disease has been effective in controlling a number of communicable diseases. Sexual partners of those with gonorrhea and chlamydia are routinely treated even when their infections cannot be detected. This approach presumably works because early and low-level infections caused by these organisms may be difficult to detect. Contact treatment of HIV/AIDS may become a routine part of controlling the disease. It is already recommended and widely used for treatment of needle stick injuries in healthcare settings. What is the human microbiome and why is it important? We share many of our organ systems, including the pulmonary, skin, and especially the gastrointestinal system, with a human microbiome made up of billions of bacteria, viruses, and other microorganisms. According to Morens and Fauci of the National Institute of Allergy and Infectious Diseases, specifically, our gut flora represents a complex external organ system that have evolved with us over the millennia and appear to affect our health, including by preventing and modifying infection. Infants who start life with or develop reduced flora, for example via pre or postnatal antibiotics, may be at increased risk of infectious diseases and emerging infectious diseases. Variations in the microbiome may also affect the occurrence of certain chronic diseases, allergies, and malnutrition. Humans have had a dramatic impact on our microbiome in recent years through extensive use of antibiotics and the development of antibiotic resistance. Today, the Centers for Disease Control and Prevention estimates that there are over 2 million infections per year with antibiotic resistant bacteria and over 20,000 deaths per year. Misuse of antibiotics in human medicine has been common. In many developing countries, antibiotics are available over the counter. In addition to the use of antibiotics to treat specific human bacterial infection, it became common clinical practice to try antibiotics as a first-line approach when the cause of the problem was not clear or was most likely due to a virus. Widespread use of low-dose antibiotics in farm animals for prevention of disease and increased growth has also contributed to the development of antibiotic resistance. What options are available for the control of HIV/AIDS? HIV/AIDS has been a uniquely difficult epidemic to control. An understanding of the biology of the HIV virus helps us understand many of the reasons for this. The HIV virus attacks the very cells designed to control it. The virus can avoid exposure to treatments by residing inside cells and temporarily not replicating. Many treatments work by interrupting the process of replication and thus are not effective when replication stops. The virus establishes a chronic carrier state, enabling long-term infectivity. High mutation rates reduce the effectiveness of the drugs, as well as the effectiveness of the body's immune system to fight the disease. Despite the monumental challenges, considerable progress has been made by reducing the load of the virus through drug treatment and preventing the transmission of the disease through a variety of public health interventions. To appreciate the efforts to control transmission of HIV/AIDS, it is important to understand the large number of ways it can be transmitted. HIV is most infectious when transmitted directly by blood. Blood transfusions were an early source of the spread of the virus. The introduction of HIV testing or HIV virus testing in the mid-1980s led to a dramatic improvement in the safety of the blood supply. Nonetheless, the safest blood transfusions are those that come from an individual's own blood. Thus, donation of one's own blood for later transfusion, when needed, has become a routine part of elective surgery preparation in many parts of the world. Unprotected anal intercourse is a highly infectious way to transmit HIV. This may help to explain the early spread of the disease among male homosexuals. Today, however, heterosexual transmission is the most common route of infection. Additionally, there is a higher risk of transmission from male to female than from female to male. A series of public health interventions has now been shown to be effective. Properly used latex condoms, male circumcision, and abstinence are being promoted in efforts to control the disease throughout the world. Additional interventions to provide protection before, during, and after intercourse are being investigated. Aggressive treatments of AIDS at an early stage reduces the viral load and the ease of transmission to others. Maternal to child transmission of HIV was a common, but not universal, event before the advent of effective drug treatment. The use of treatment during pregnancy and at the time of delivery has dramatically reduced the maternal to child transmission of the infection. Today, this route of transmission is close to being eliminated, which is an important public health achievement. Breastfeeding represents an ongoing and more controversial route of transmission. Up to 25% of HIV-positive breastfeeding women may transmit HIV to their children. In countries where breastfeeding provides an essential defense against a wide range of infections, the issue whether or not to breastfeed has been very controversial. Fortunately, a drug treatment of HIV infections during breastfeeding has been shown to greatly reduce but not eliminate transmission. Finally, HIV can be transmitted through contaminated needles. Thus, the risk of HIV transmission needs to be addressed in two very different populations: healthcare workers and those who abuse intravenous drugs and share needles. New needle technologies and better disposal methods have reduced the likelihood of needle stick injuries in healthcare settings. Post-exposure treatment with drugs has been quite successful in reducing healthcare-related HIV infections. New diagnostic tests for HIV that allow for detection of the disease in the most contagious early weeks of the infection are being investigated for widespread use. To be effective, testing for early disease would need to be coupled with rapid case finding to identify and ideally treat contacts. What options are available for the control of influenza? Influenza A is a viral infection that has long been capable of a pandemic or worldwide spread. Its ability to be rapidly transmitted through the air from person to person and its shortened incubation period have made it an ongoing public health problem. It often kills the very young, the very old, and those with chronic illnesses, particularly those with respiratory diseases and suppressed immune systems. In addition, the disease continues to mutate, creating new types against which previous infections or previous vaccinations have little or no impact. Thus, new vaccines are required every flu season. Seasonal influenza deaths vary widely from year to year. Influenza has killed approximately 3,000 to 49,000 people in the United States alone in recent years, though these numbers can be expected to reduce with the increasingly widespread use of vaccinations. A variety of public health and medical interventions have been and continue to be used to address the current and potential threat posed by influenza. They may well all be needed to address future threats. Let us take a look at a number of these interventions. Inactivated or dead vaccines have been the mainstay of immunization against influenza. Unfortunately, current technology requires approximately 6 months lead time to produce large quantities of the vaccine. Thus, influenza experts need to make educated guesses about the next year's dominant strains of influenza. In some years, they have been wrong and the deaths and disability from seasonal influenza have increased. New technologies for vaccine production are now available and should be able to help us with this issue in the future. In recent years, live vaccines administered through nasal spray have been developed and increasingly used. These vaccines are more acceptable than shots to most patients and are now considered safe for a wide variety or a wide range of age groups. Unfortunately, recent data indicates that nasal spray vaccines have not been highly effective and they are not currently being recommended by the CDC. Medications to treat influenza and modestly shorten the course of the disease have also been developed. Influenza experts view these drugs as most useful to temporarily slow the spread of new strains, providing additional time for the development of vaccines to specifically target the new strain. Widespread use of influenza drugs has already resulted in resistance, raising concerns that these drugs will not be effective when we need them the most. Efforts are underway to develop new drugs and reserve their use solely for potential pandemic conditions. Despite our best efforts, influenza is expected to continue its annual seasonal epidemic and to pose a risk of pandemic spread. The use of barrier protection, such as masks, isolation methods, and even quarantine, has been considered part of a comprehensive effort to control influenza. It is clear that we have a variety of public health methods to help control the impact of the disease. It is likely that we will need all of these efforts and new ones if we are going to control the potential deaths and disabilities due to influenza in coming years. What options are available for the control of rabies? Rabies is an ancient disease that has plagued human beings for over 4,000 years. It is caused by a ribonucleic acid virus that is transmitted through saliva of infected animals and slowly replicates. It spreads to nerve cells and gradually invades the central nervous system over a 20 to 60-day incubation period. Once the central nervous system is involved, the disease progresses almost inevitably to death within 1 to 2 weeks. Any warm-blooded animal can be infected with rabies, but some species are particularly susceptible. Most commonly, raccoons, skunks, and bats. Cats and dogs can also be infected and transmit the virus. A multi-component vaccination strategy has been very successful in preventing the development of rabies in humans. In most recent years, there have been between 1 and 5 fatal cases of rabies per year in the United States despite the persistence and periodic increase in rabies among wildlife populations. That's all for communicable diseases. And this is the reference or book that I have used for this lecture. Thank you so much for listening and have a great day.